The first ever Cuba-Belize Medical Symposium took place today in Belize City. It was held to mark the 26 years of medical cooperation between the two countries. Since the 1990s, Cuban doctors started working in Belize, and later Belizeans got the opportunity to pursue medical studies at one of the biggest medical schools in the region. The cooperation also provided the opportunity to some Belizean patients to get medical service in Cuba. Today, they officially commemorated the milestone with a symbolic plaque.
A key issue here is the preparation of human resources. As the Belizean people know, there is a Latin American School of Medicine in Cuba for more than 20 years. That was an idea of our late President Fidel Castro in 1998, when we decided to help others in terms of healthcare, but then he said, why don't we prepare the human resources in Cuba? And then they can go back to their countries and they can serve to the poor guys, to the poor people, not only in capitals, but also in those villages and that where they need that help. So due to that project, more than 100 Belizeans has been prepared as doctors. And now they are working, spread it out in all of Belizean territory, together with the Cuban medical. So I think that that's one of the key issues in that improvement that you have mentioned. And the other is that we have been collaborating in many fields. In Belize, we have now 72 medical personnel, from nursing to specialists in different specialties.
CEO of the KHMH, Dr. Adrian Coy, shares the impact of the Cuban Medical Brigade on the KHMH.
What I can recognize since my time there has been these broad areas of support. Training, active participation, meaning the actual personnel on site. And of course, we know that patients do leave from Belize and go to Cuba for care on very special occasions. We recognized earlier today that some of our most senior colleagues in health have been trained in Cuba, and they came back home and did what they were trained to do, and they have made the impact. The waves of trainings have been happening over the years. So from a doctor's perspective, we've seen the different specialists: general surgeon, orthopedics, pediatricians, obstetrician, gynecologists, gastroenterology, cardiology. And these are key specialties that have really augmented and widened the range of services that we deliver at Karl Huchner. It will continue, I'm sure. Right, right, Ambassador? The majority of our junior doctors in Belize, I think, and perhaps almost half of the existing body of physicians at this point are have been trained in Cuba, or their specialization, etc., has happened. 10 nurses and a biomedical technologist. Now, globally, our specialist body is just under 30, and so you would see that 10 out of 30 is an important percentage. Almost a third of our specialist workforce then is actually representations from Cuba. We don't have medical officers from the medical brigade, but additionally we have about 45. Of the 190 nurses, as I said, 10 are from the medical brigade of Cuba. Because of the impact of the medical brigade of Cuba for all these years, there is no way we could have been doing what we are doing now and advance the way we have advanced without the generosity of the people of Cuba.
The event included presentations from Cuban and Belizean medical doctors on a number of conditions and diseases, as well as discussion on public health and medical related topics. Reporting for News 5, I'm Andrea Polanco.